Welcome to Medicare Lagniappe, where we cut the confusion on all your Medicare-related questions and cover topics plus real-life scenarios to empower you for a better understanding of your Medicare options today. Welcome to Medicare Lagniappe, Bustle Group's premier site of learning everything about Medicare. My name is Caroline Badon, Director of Agent Experience at the Fussell Group, and today I'm here with our Agency Director, Jeff Myers. We will be discussing Medicare Part A and B. Jeff, thank you for joining us.
Thank you, Caroline.
So Jeff, what is Medicare Part A?
Wow, great question. Medicare Part A is it's really what you've worked for over your working life. Once you've retired and you need to go into the hospital, Medicare Part A is that hospitalization that you can then use. Say you need to go to an urgent care facility. That's also Medicare Part A. For most folks, they've had a working career. Maybe they worked for an entity as an employee. Then typically they will have paid in their 40 credits or 40 quarters that they need in order to be able to qualify for Medicare Part A. Some folks that maybe have been self-employed or maybe have their own businesses and whatnot, if they haven't been paying their Social Security taxes on a quarterly basis or whatever, then they may have a different challenge that they may, once they are electing Medicare Part A or want to enroll in Medicare Part A, they're then going to have to back pay any of that in a monthly installment or a quarterly installment through Medicare in order to be able to qualify for that.
So the qualification for Medicare is once you turn 65 or if you have some kind of special need of any sort. Does one have to enroll in Part A? I know, I just kind of want to clarify that a little bit.
Typically, when you turn 65 and you become eligible for Part A, you automatically are enrolled or have the eligibility for Part A. If you're under a group health plan, typically you don't have to take it up front, but it's generally just there for those folks that already turned 65 or that when they are having a qualified disability, have been disabled for 24 months or longer under a doctor's care, then they can have that access to the 24 months, and that gives them the Part A.
Okay, so Part A is hospitalization. It's the hospitalization part of Medicare. What is Medicare Part B?
So Medicare Part B is really just your doctors, your specialists, any ancillary care that you might get that is not necessarily through a hospital. So if you have a common cold, if you have things of that nature going on, then you're going to want to obviously go to a doctor, not to a hospital for that. That's what Medicare Part B is basically taking care of.
And you said Part A, you work your 40 quarters or you pay into Part A if you haven't worked your 40 quarters. Correct. How does Part B work?
So Part B is different in that you have to apply for Part B and then you have to elect, and it's on an annual basis. They change the pricing for this. So someone that is now eligible for Part A and eligible for Part B, if they elect to do it, they're going to have to pay for that on a monthly basis. Most of our clients, you see them doing that through a Social Security distribution. It comes out of their Social Security check. But we have some folks that maybe they turn 65, they didn't elect to take their Social Security distribution until 67 so that they can make a higher monthly amount. So they're now paying that on a monthly or quarterly basis directly to the Social Security Administration or to Medicare.
Okay, so to kind of like paint the picture for the viewers, Part A, if you've worked your entire life, your 40 quarters, your 10 years into the workforce, you get Part A automatically. You're automatically enrolled when you turn 65.
That is correct, yes.
Then you can elect to pay for Part B. So it would either, if you're not taking your Social Security check, you would pay for it. Or if you are getting your Social Security check, they could just deduct that from that check.
That is exactly correct. Now, the other caveat to that is for those folks whose combined households, are making over a certain threshold, typically their Part B is going to be a little more than most folks. So, sometimes people are sitting around a coffee pot or they're having conversations and, Mr. Joe may be paying a certain amount, but then Miss Bonnie and her husband have a higher income, let's say during retirement age, and she's trying to figure out what her Part B cost is going to be. Her Part B cost may be higher because of their level of income in the house, or maybe her level of income alone. So, each one of them are going to be maybe different, based on their specific needs or whatever. But, that's why we provide licensed and certified agents locally to be able to help them navigate some of those things and understand what that looks like.
Yeah, and you did say that annually the Part B premium could be different. So that is something that beneficiaries need to look out for. Is their Part B premium increasing or decreasing?
That's correct. So, a lot of times you hear that Social Security is giving the beneficiaries a raise, right? A Social Security raise. Well, usually when they give a raise, the Part B premium is also going to adjust higher. If there is a retraction, maybe sometimes Part B premiums will go down. We saw within the last couple of years, the government pulled back some of the Part B cost to be able to help some of the folks who are having challenges with pharmaceuticals because it put more money back in their pockets. So it could ebb and flow depending on what the federal government is doing.
And I know that these are very confusing topics for members and those that are not licensed insurance agents. So one of the main things they can do is call the Fossil Group and have a licensed local Louisiana insurance agent kind of guide them through the process and
100%.
kind of cut the confusion for them.
Yep.
So that's all for today. Jeff, thank you for joining us. If you've enjoyed this video, like and subscribe and stay on the lookout for more. Follow us on Facebook, Instagram, and visit our website, fgiala.com.